would like to introduce the next speaker, which is Dr. Alexander Angelov. He is a medical doctor and founder and president of the TrueHealingMD Integrative Medicine Inc in the USA. His presentation will be about integrated medicine in the era of the pandemic. Well, Alexander, go ahead with your presentation, please. Oh, yeah.
Can I share my screen?
Mr. Elliot Pines, could you please stop screen share?
Can you let me share my screen?
And I apologize. I didn't realize the order changed.
Okay. I hope you see the screen. Do you see it? Yeah, okay. So let's talk about the medicine during this global pandemic that we are engaged. I didn't think that I will live long enough to see what is going on right now, right in front of our eyes, where the old system is crashing and we have place for new system to arise. So let's, oops. So what do we know about medicine so far? It's not medicine anymore, it's medical business. And in this medical business, we have to have the sick person, and disease is driving this business ahead. We have to find disease in the early stages, to treat earlier, and to save from the very bad outcome. And we have pills for everything. We can treat everything today. If not pills, it will be knife. If not knife, it will be chemotherapy or something else. And all algorithms that we have today are based on the money distribution. So with all of this, we feel that a lot of people have to get the biggest piece of the pie in the healthcare system. I'm sorry, health don't care system. So we have the pyramid of the people who are, running into this business and trying to get first to the place. And on the top of pyramid is the patient. So we treat patient as the source for our income, for our money. But look at the patient. It could be your mother. It could be your grandmother. It could be your neighbor. Who cares about the person? And we have money on the table that paid by patient or the insurance company or government. And let's game begin. Whoever will be first. And this is the healthcare system that we have today, which is disease management business, basically. We have production line. And in this production line, we have 5 minutes per person to check, examine, give pills, give prescription, next. And we are very efficient. Everything is booked. We have tons of patients. We promote tons of diseases. So we are good. Our business is growing. Emergency rooms are full. People come to emergency room with everything and anything that they think has to be treated. And we're basically at the end of the road with this type of system. And everybody is so frustrated, whether you're a patient, you're a provider, you're part of the system. And here, pandemic came, unexpectedly. Wow, Corona is here. Welcome. So the medicine divided today in two big parts. One is the front line, the physicians and nurses in the intensive care units, in the hospital, trying to save lives. And my heart goes to them because the condition that they're working in, absolutely unbearable. They work 12 hours in all ammunition. They have probably one or two times where they can go to the bathroom and eat something. And the shifts are over and over and over again. And for all this time of pandemic, the physicians and nurses are very, very exhausted. On the other hand, the outpatient clinics are closed. Even if they are not closed, the volume of the patient that comes through these facilities are very minimal. But pandemic is something real that is growing, and we know in the media that it's something difficult and something bad, and we are scared, actually. And doctors are frustrated because we don't have any answers. And all of a sudden we realize that we have a real-time experiment. First time in life, we have real-time experiment. What does it mean? We can trace virus. It's first time in the history where we can trace virus in the country, in different countries, the moving this virus between different countries. But it's not enough. We have also another example of the real-time demonstration. So we have parade in Belarus, May 9th, in the middle of pandemic. Look at how many people are there. No one wears mask, and spectators are people who served their time in the World War II, very vulnerable people. And you would think that it's craziness, right? So it's in the middle of the hump of the disease. And yet this red line is where this parade was. Look, you would expect that amount of cases will be doubled, tripled, or quadrupled. No. So basically, we have no idea what coronavirus is. We have no idea from standpoint of the science, the medicine, and we are making the same mistake over and over again. We intubated people, and only 14% of the people get alive out of this intubation. So 86% of the people who get intubated are died, and yet we continue to intubate people. So we have no treatment. We have no understanding what is going on. How do we get to this cross section between health and happiness? Okay, let's think what did we have before? Historically, we had the provider, person who wants to help patient, and the patient. So the provider provided health, and patients will compensate on whatever the patient can. But then between patient and provider, we have the whole system that wants to create the business, money, and everything. And we become a very disconnected, disintegrated world. At this time, Corona came, and we start to see positive changes. We start to see that above and beyond government, regular physicians start to talk to each other, start to share their information, start to understand what to do with this pandemic and how can we get around it. So we start to be integrated on the level of the providers. We were begging for telemedicine for a long time, but no, we can't. And now government is saying that telemedicine is the standard of care. Is it possible to do the telemedicine and provide good health? I can tell you that I am doing it already for 8 months, and everybody enjoys it. Because today we have so much technology. Remotely, I can listen to the heart, to the lungs, I can look in the ear, I can look in the throat. So I have my means to examine patients even remotely. But at the same token, patient doesn't have to drive hour to my office, sit in the waiting room for 30 minutes, and then get examined and then drive back in traffic another hour. Patients start to communicate. Patients start to integrate and share because they cannot go to emergency room anymore. It's dangerous. They want to be healthier. They don't want to go to emergency or urgent care because they want to avoid COVID-19. Communities start to be a little bit more tight to help each other. So that's a positive move that we see as a result of the COVID. Finally, in the center of this connection between providers and patients and everything was disease and money. And slowly but surely, it changed to patient-centric, health-oriented environment. So it's a real time right now that we can come together, providers and patients, and we recreate new medicine that will be good for everyone, integrative medicine. We cannot wait that government will do it because they have the same agenda as before COVID. So it's our role to come together, a round table, and think what will be the most effective way to promote health and be healthy in this life. At the end, we are one big family. Whether you're a physician or you're a patient, we're a big family. And if we integrate it in this family, everybody wins. I have little time for questions.
Thank you very much for this wonderful presentation.